All right, guys, welcome back to the Primetime Podcast. I have the pleasure of being here with Dr. Alicia Brown.
Hello.
So thanks so much for letting me come on over here and check out your location. It's been absolutely amazing. I've actually swung over here before and was kind of blown away. And I was like, all right, my viewers and people really need to know you guys are out here and what you guys are doing. So Dr. Alicia Brown, we're at Better Brain and Body, which is in the Southern Charlotte area. And she's a board-certified chiropractic neurologist.
Yes.
Absolutely. And like you guys, I was like, what is that? So I had to kind of learn a little bit more. So we'll just kind of get right into it. Tell us a little bit about what a board-certified chiropractic neurologist is.
So I am a doctor of chiropractic. I have my doctorate from Life University in Atlanta, and then I have postdoctoral education in clinical neuroscience. So most of our education is geared all around more the functional aspects of neurology.
Nice. Love that. So what are the schooling requirements? What does it take for you to become what you are?
Right. So you do need the doctorate of chiropractic, of course, to be a chiropractic neurologist.
Okay.
Other professions can be functional neurologists, and there's an American Fellow of Functional Neurology. But we have our doctorate, and then postdoctoral, you need at least 300 hours of study in neuroscience in order to sit for the diplomate exam. And then, but most of us actually have thousands of hours before we even bother sitting for it, because it's not the easiest exam ever.
Makes sense.
Yeah,
Holy
so
cow.
in order to get that certification.
Okay.
Yeah.
Wow, awesome. So what initially got you interested? Like if I told my 2-year-old daughter right now, like, what do you want to be? She probably wouldn't say chiropractic neurologist. So how did that turn out?
Well, so when I was 12 years old, my father went back to chiropractic college. So he was, working nights in a grocery store and was like, this isn't cutting it. So he actually moved our family to Iowa. He went to chiropractic college in Iowa at Palmer College of Chiropractic, and while he was there, he learned of chiropractic neurology.
Oh, okay.
So he came to me when I was probably 13 or so and was like, hey, there's this guy that wakes people up from comas with a blow dryer. I was like, that's pretty cool.
Wakes up people with a blow dryer. I just want to make sure I got that correct.
So in hindsight, he did warm calorics in the ear, which activates cerebellum and stimulates the brain and can actually wake somebody up. So we, but from a very young age, even the chiropractic piece of it, I was like, wait, I get to help people and make money doing that. That's amazing, right? Same thing with you, right?
Yeah.
I'm sure. But then learning about that neurology piece, then when I got to chiropractic college, I went to neurology club, I took the courses. And
what was it about it? Like maybe when you're in the neurology club, what kept striking your chord and say, wow, like this is for me?
This is it, yeah. So I actually, the first courses that I took were Dr. Robert Malolo's courses on childhood developmental disorders. He's written Disconnected Kids, Reconnected Kids, and a book on preventing autism. And in really learning about the brain and how it works and how we can help people with through activating their nervous system, sensory and motor modalities, to help improve their brain function and their quality of life was just like so amazing.
That's amazing. Heck yeah. And such a need. Yeah. I mean, even when I had concussions in high school, I would have killed for something like this after concussion. But, it was like rub some dirt on it, like get back out there. And like there's so much more.
Yeah.
So much more and we'll kind of get into it a little bit more. So what would, and it's super vague, so feel free to take as long as you need to on this, but what would a typical treatment look like? Because most people are thinking, well, is she chiro? Does she crack necks? Or like, what exactly does she do?
Yeah, really it starts with our neurological exam, and we do 5 separate diagnostics. To make it simple, we look at eye movements, timing and rhythm, balance, and brain waves.
And brain waves, awesome.
We do sensory motor exam, gait analysis, and from there we can take the information that we get from that to see which areas of the brainstem, cerebellum are under functioning, and then our therapies are directed towards activating those areas very specifically. So we love the beamer. We'll put people on there that increase vasomotion to increase microcirculation to the brain and body.
Did everyone catch that? So I just want to make sure they receive, because you're like woo up really here nice. In terms of no, in just terms of you can tell you do this stuff day in day out, right? You're just in swarm with it. I just want to make sure all the viewers and listeners get what this awesome machine is. So you were saying a little bit about vasomotion, is that what you said?
Right. So the beamer is it's an electromagnetic field.
It's an electromagnetic field,
that helps to increase the vasomotion, which it helps for the oxygen nutrition exchange at the microcirculation level at the capillaries.
Helps oxygen in the blood. If
oxygen,
we really boil it down
nutrition,
simple.
really, get blood flow to your cells so that they can heal and repair and do what they need to.
Okay.
Yeah. So we'll usually start there to help get some good blood flow to the brain, and then we do different head-eye movement therapies. We do things with interactive metronome with the timing and rhythm.
Yeah.
We have the neurosensory motor integrator. If you remember, it's a touch screen, and we can do a lot of hand-eye coordination, memory tasks, things like that. We also have the Gyros Game therapy, which we have one of about 30 in the whole world.
Whoa.
Which is pretty
so tell
cool.
people more about that. Like, what is that most people don't know what that is?
Yeah, so it's a mechanical chair that we strap you in, and we can actually rotate in different directions for vestibular stimulation. We can have people, there's targets in it, and you can have them hitting with a laser pointer the target. So that really helps with your brain's ability to perceive a target, process it, and then respond to it. So we're looking at accuracies, reaction times, processing speed to really just help overall.
Absolutely.
Yeah.
And I heard you say earlier that you can assess their brain waves. So people are like, wait, what? So tell us about like kind of how that works.
So we put on a cap that has sensors in it, and we actually read the electricity coming off the brain.
So you can literally see the waves coming from their brains.
Yep. Okay. So we're looking at the alpha, beta, delta, theta waves in the brain, and we can look at age and sex matched if they're too high in some areas, too low in some areas, and then we know areas of the brain control certain things like language versus attention versus memory, and we can really and what those different waves do, and so we can help to to retrain those, and we do that with neurofeedback.
It's amazing.
So we use neurofeedback to help retrain those.
That's awesome. So if I struggle cleaning up after myself, can you plug me up and find that my A waves aren't working well, and you get those going, and my wife will love you to the end of time.
All of a sudden you start doing the dishes. I don't know, lady.
No, we're talking.
I'm going to come up with a very specific therapy that will help your man help keep the house clean. All right.
You would need 30,000 of these all over the world if you find that. Because I know for me, well, this is funny. After concussion, I guess before I was always really clean and neat.
Yeah.
And since then, it's kind of the running joke is careless all get out. I have to work really hard to be focused and just like I said, cleaning up is all.
Well, hey, our organizational skills and those higher level things are really in our frontal lobes.
Yeah.
So kids don't always have that, and it develops as you go. But you get hit in the head and you lose some of that.
It's amazing.
Definitely sometimes.
Yeah, it can happen.
Yeah.
So, in all seriousness, though, what kind of problems would you say you guys are solving here on a daily basis?
Yeah, we work with ADHD, autism, so childhood developmental disorders, learning disabilities, and then neurodegenerative disorders, looking at early dementia, Parkinson's.
Gotcha.
A lot of movement disorders, tremors, and then traumatic brain injury, concussion is huge for us. One of the big things that I'm all about is baseline testing. Don't wait until something happens.
Absolutely.
Get the testing done, see where you're at. Then if you start to see, my memory doesn't feel like it's as good as it was, or if you're strokes, concussions, they happen all the time.
Right. And
then we have a baseline to say you were here, now you're here, and then we have a goal to get back to, or even better than.
Right. Yeah. Right. So maybe if someone has dementia in their family and they're kind of concerned. So you're saying they could kind of come and just get a baseline testing, and then what would they track it every 6 months or once per year? Or what would you kind of say?
I would say, possibly, but it would really be there. So if something does, if you start to feel changes, we're going to have an objective.
Yeah.
Because subjective, I
feel
right. Lose my keys, but we're no, your occipital lobes were green on the brain map and now they're blue. They're decreasing, or that's the visual memory. Or your reaction times we see with dementia where, we'll look at fast eye movements and they should be between 150 and 200 milliseconds, but now they're at 300. We know that you're slowing down.
Yeah.
So we would have something to measure to get back to.
Awesome. And honestly, this sounds really appropriate for any athlete, right, with sports, right? So tell us how ideally this could be integrated in any athlete, whether they're heading into the year, in the off season, during the year. What would that look like?
Yeah, again, baseline testing. Concussions happen all the time in sports, but then being the best that you can be.
Yeah.
All the things we do, like I said, with the gyro stem, we can rotate the gyro stem at random combinations of movement, so you can't predict it. Very fast, up to 30 revolutions per minute.
Craziness.
While you're hitting these targets. And so, you think about an athlete who their target's moving, they're moving,
all
other
the cognitive
people are
functions
moving,
needed.
and you need to hit your target. And you need to predict where it's going to be and where, so we can use the gyro stem for that. We work on hand-eye coordination, really remapping where you feel where things are in space. So when you see that QB, who keeps throwing over to the left, we need to get them going straight on their target. And a lot of athletes do this, and then they start compensating. They know they're going to the left, so they start throwing right. So sometimes we got to retrain them. Then they're like, no, this is actually
don't overcompensate.
Don't overcompensate once we actually remap them.
Man, that is stinking awesome. Let me just kind of move into some of your greatest success stories. So, what does the world need to hear about in terms of maybe a success story or two that everyone needs to touch on?
I've seen so many people that, I had someone a few years back that had a very severe concussion, very severe, and vertigo, like basically didn't function. She was a high-level athlete before that. She actually got the concussion kayaking.
Oh, wow.
And hit her whitewater kayaking, hit her head on a rock, and was suffering for 4 years, had been to many different specialists and everything, and she's like, you know what, you're my last-ditch effort. Otherwise, I'm just going to be like this forever. We saw her every day for a week, and then I sent her home with some exercises for a week, and she came back and was like, I didn't know what it was like to be able to see clearly and not be dizzy and not have a headache. Right. And now, since then, she's like climbed Mount Everest.
Oh my God!
Kayaked the Nile.
What?
I mean, it's insane. So and she just really got her life back, and that's what it's all about for us, is just helping people get their life back, improve their quality of life. We don't want people to suffer and go to 40 other doctors before they find us. We want, we're here to help people.
Absolutely.
And
I love that.
We're very passionate about it, and we love our patients, and we love seeing them succeed.
So guys, too, I've for those of you listening, I've kind of went around and taken a tour, and there are so many tools here that you won't find anywhere else. What was the name of that?
The gyro stem. The
gyro stem. So for that, just to paint you a picture, you're sitting in this chair, they kind of strap you in, and you move like a Walt Disney ride kind of thing, up and down, you rotate while you're asking them to do cognitive tasks. So I just want you guys to have that kind of visual of how demanding that is. And it makes a lot of sense for people, especially the athletes, to return on the field. They've got coaches yelling at them, play formations are changing, audibles are being called. And if they're trying to recover from an injury or concussion, that's a ton to process and to focus on, right? To be present at the moment. So that's one thing that really sticks out. And then I remember wanting to ask you about balance challenges. So for our everyday, we're all getting more challenge in our balance, right? And it's kind of like, who doesn't need to improve in their balance?
Yeah.
And we know that falls can be...
They're the number one risk in every age group, except for 20-year-olds, that's car accidents, but every other age group, falls are actually the number one risk.
That's crazy. So legitimately almost everyone could at least come in, and we'll talk a little more about that in a second, about how to get started. But saying that someone really just wants to value their health and take care of themselves now, and maybe they're starting to notice that their balance isn't as good as it used to be, what would kind of their treatment plan look like? Like, how would you kind of move forwards with that?
Yeah, so one of the big assessments is computerized dynamic posturography, where we really measure their balance on a flat surface, eyes open, eyes closed, on a cushion, eyes open, eyes closed, with your head right, left, forward, backward. So we do a very thorough assessment of balance and different sway patterns, where they're weaker, and then we do things very specifically. So we might do things differently on the gyro stem, where we only spin them in one direction to actually change their perceived center of pressure in order to affect their actual center of pressure. Wow, that's awesome. And then also, if we see they're unsteady and they have unsteadiness in their eye movements, we'll do things for like gaze stability. So there's a range, or some of the things that we might do just sitting down with somebody, we might do on a Bosu or on a balance pad. Yeah. So there's a lot of different options for balance. So
again, guys, we're a better brain and body. I mean, there's so much that almost everyone could probably benefit from here, for sure, right? And so let's say someone's like, okay, absolutely, it makes sense. There's not really been a great professional that's assessed my neurology. A lot of us have had just bad experiences in the typical field out there, in all honesty. So how would someone want to, how would they get started with you, and what does that process look like?
Yeah, give us a call. Or they're on our website. There's a contact form.
We'll post your information. I'll post the information below, whether you're listening to the podcast later or Facebook Live right now. I'm going to go ahead and put that in the commentary just to make sure they've got that. So
contact us either via phone or through our website, and we will always do a free 15-minute consultation because we know a lot of people. They've been everywhere else. They've spent a lot of money.
Absolutely.
They want to know what makes you different, and can you help me before I spend another $1, please?
Absolutely.
So we will always do that free 15-minute phone consultation. If you just want to get in, my assistants can get you on the schedule and explain and send you the paperwork, and we'll get you started.
Yeah, that sounds great. So guys, leave any questions that you have below. But I was lucky to come over here and take the time to interview Dr. Alicia.
And thank you so much.
Thank you so much for allowing me to come on out, guys.
Yeah.
And until next time, we'll see you guys later. So I'll go ahead and close up shop here.
Bye.
All right. See you guys.